Hi, my name is Sarah Renberg. I'm from Ann Arbor, Michigan. So I got to work with Dr. Bryce for a long time. Before working with him, I was, your stereotypical high-achieving student athlete, A student, and I was being recruited to play ice hockey in college, and I also played soccer for my high school. I worked with Dr. Applebaum first after like a standard sports concussion, and I was able to return to play and play some of the best hockey of my life. I think I scored more goals after that period than I had the entire previous season. I later sustained more significant brain and neck injuries in 2014, which caused physical and cognitive deficits, including a severe dysfunction of my autonomic nervous system, which created some additional complications. Vision-wise, I had some double vision, lacked depth perception, couldn't read or focus my eyes. I got car sick, couldn't easily tolerate movement, and places, with crowds or visually stimulating places like the grocery store. So especially after the second injury, all of a sudden I was a junior in high school and I couldn't read. And I'm getting ready to take my SAT and that was just going to be a nightmare. And I do want to make clear that vision therapy, was one component of my rehab. So I got a degree in biopsychology, cognition, and neuroscience. So I've gotten to appreciate, the beautifully complex sensory systems that our brains allow for. So even something like turning your head like this, requires a vision, vestibular system, and musculoskeletal systems, just to like oversimplify it. That being said, I think vision therapy helps to train and optimize your visual skill set, and was definitely, one foundational cornerstone of my rehab process. I think it played its biggest role in my return to the classroom. So reading, screen use, tolerating busy environments, and allowing me to ultimately go to college. I definitely credit Dr. Bryce a big portion with my ability to matriculate to the University of Michigan. Yeah, so my most recent dose of vision therapy came after a brain surgery I had this past May. And with this run, I felt like I was getting better control of my eyes, and it helped with stamina, which helped me return to work and get back behind the wheel with confidence. So vision therapy has allowed me to do many things like, go to the big house with to watch a football game with my friends, not, feel nauseous and pukey. But reading is really a primary one. So early in my injury recovery, I had to work at actually, seeing the words on the page. And then once I could make them single and clear, comprehension was a factor, and then building stamina. And so, to get to the level that I wanted in order to succeed, in college and beyond, vision therapy played a big role in increasing my comprehension and speed at reading. And with the help of vision therapy, in addition to the other rehab modalities, I graduated Phi Beta Kappa from Michigan, so you could say I read like a champ now. With the injuries, I felt like I lost everything, and including any sense of control. And, that's a pretty standard knee-jerk reaction to any sort of adversity. And what I've learned is like how much power we do actually have to make a difference in our outcome, and just hoping passively won't get you far. So for me, that looks like living in a way that supports my healing. I went and got a neuroscience degree so I could be empowered in the physician's office. And I just think people fail to appreciate how much good habits can give you some sense of autonomy within your own life. You can put yourself in the best situation to have a good outcome. Big picture, my goal in the immediate future is to hopefully attend medical school and use what I've learned throughout this healing process from the other side of the exam table, and be able to do right by my patients, and really push the limit moving forward on helping others achieve optimal brain health. And long term, I want to be like the cool mom that drives carpool and helps coach the sports teams and stuff like that. So I'm excited to have a future with limitless possibility, thanks to a working noggin. So, being a vital visionary to me means going through life with clarity, pun intended. The challenges I face force me to hone in on my values from a young age and, trust my gut when making potentially life altering decisions like what sort of brain surgery I should have. And so I really think my eagerness to learn, question, and take things in like a sponge in the doctor's office were big factors in my ability to lead the life that I get to now.